Hello, good day, everyone, and welcome to my channel. My name is Chad Royer, and the name of the channel is What's Up with Chad Y. Royer. I continue my journey as a cancer survivor, where I talk about my journey fighting multiple myeloma. Folks, if you haven't done so, feel free to subscribe to the channel, like and leave comments on the video so that way YouTube knows how to push it forward. And I'll just start by saying it's been an up and down year so far. I just recently got sick for a few days, not being able to eat properly, threw up a few times, but I feel the worst has gone already. And now I'm just dealing with what I think everyone here is dealing with, the frigid temperatures, the cold weather, 5 degrees, 10 degrees, 13 degrees. We had a lot of snow, and I know it's been difficult for people to travel, or if not impossible. I hope everyone is safe and well. But there's some other things that is happening right now that, too many to number with 10 fingers. The issue of health insurance, health insurance always is a trigger word or trigger words for me. So I happen to have United Healthcare, and United Healthcare happened to be the insurance that we use. Um, and we recently got it through matters that happened that were beyond our control. And if you have United Healthcare, you probably got a notice or a series of notices that certain areas where you use United Healthcare will expire at the end of January, which means if you were in network with your provider, you'll be out of network in February. Now, just let that sit there for a minute. I still go and make visits to my oncology team. I have an upcoming bone marrow biopsy. I have a scan. I have to do lab work. I still have to get my meds. I still have my regular doctor that I still in the works of working out where I can make my appointments. I still have other things to worry about that's health related. Oh, don't forget the dentist. Yes, we got to see the dentist as well. And the news that United Healthcare is far apart from reaching certain agreements has people puzzled, confused, but a simpler series of words, I would just say left out. So, in a case like mine, I fought cancer, I defeated cancer, but cancer, it's tricky. Sometimes cancer wins the battle, and sometimes it doesn't. But in my case, I live to tell the story. It would just add to whatever financial burdens are there if in network coverage doesn't exist anymore. Just thinking of the co-pays going up, the deductibles, not being able to reach your deductible, any kind of urgent care visits that you have to make, or ER visits. Uh, what if you, there's a number of things that can happen. But let's say I didn't have my cancer diagnosis and I was just going by my annual visits. Maybe I wouldn't be impacted as much. But as a cancer patient, cancer survivor, someone who's going through the treatments, and we have to do our regular checkup, we should not be missing those appointments. We should not be delaying them beyond reason. We should be doing our best to keep up with the care that's needed. And what's happening, United Healthcare is a major corporation just like other corporations that provide health insurance. They're adding risk to those who need the care a lot more often than others. And unfortunately, I fall in that category where I need care more often than most people. So not only is it a stressful situation, not only is it a situation of uncertainty, it can lead to a financial burden. I mean, do we have to restart the GoFundMe? Do we have to start selling blood? I mean, what other options would we have if we're not able to get this situation straightened out? Well, in my case, I've been home doing what I can to get better. And the one thing that might buy me some time is that I got a call from the doctor's offices trying to get some advisement on how to move forward. Contacted the insurance company. They said I need to get a continuance of care application form signed by the doctors and professionals who may be impacted, have them sign it, have them send it over to the insurance companies in an effort to buy more time. Now, it's not necessarily a guarantee of an outcome, but if it buys time, I'll take it. But when the time runs out, when May 1st comes, assuming that I get a continuance, or if anyone gets a continuance of service under the existing provisions of in-network coverage, once May 1st comes, then it's out of our control. We will be out of coverage unless we pay out of pocket, or if we are fortunate enough, and I say fortunate enough, to find another company, another carrier that, one, is available, and two, that your medical service providers will accept. So just thinking about this honestly has me not so relaxed, a bit concerned. But now I have to make sure that I scramble to make sure that whatever appointments I need, I'm going to need to line them up as soon as possible in the event that my coverage is no more in network. This is a big challenge for me. I don't want to have to change doctors. They've worked with me for so long. They know my situation. I have questions that only they know the answers to. And when you're dealing with an oncology team, you're dealing with someone's life times 5, times 7. You're dealing with, in most cases, someone's second opportunity in life, or their one shot to beat death. And I'm going to be honest with you, it's not fair that members, subscribers, people who have the coverage now, who are in danger of losing it next month or next upcoming months, have to make that decision. It's just not a good situation. I don't know if anyone in a position of power will see this video or any part of this video, but I urge that an agreement be made to continue in-network coverage for patients, especially patients just like myself, who have visits that are very crucial to their substating of life. That was a lot to unpack right now. And what I wanted to talk about before I did this video was that there have been some medical advances in the study of how multiple myeloma works in the body and the new technologies that can actually fight the cancer cells using different methods, with promising outcomes. I hope to bring that forth in the best way that I can. That should be coming soon. So stay tuned. So I want to thank you for taking the time to listen to me today. Be safe out there. I know the winter weather is very challenging right now. Please don't forget to subscribe to my channel if you haven't done so. Please like and leave comments. Share with folks that you know. You be safe. You be well.